Hello and welcome to Factomania. This is Vishu. Plasma therapy. Well, we will start from the history. It is a 100-year-old technique to treat diseases. Plasma's use as a treatment began in 1890. So, what is plasma? Plasma is a clear, straw-colored liquid portion of the blood. Plasma is the largest portion of our blood. It makes up 55% of its overall content when separated from the rest of the blood. It contains water, salt, enzymes, antibodies, and their proteins. Plasma therapy is not something new, as we may have heard of its use over COVID-19. In 1918, it was used to treat Spanish flu, in 2009 H1N1 infection, and in 2014 Ebola viruses, 2015 MERS, and now in 2019 COVID-19. The journey began with the name Emil von Behring, a physician who purposefully exposed horses to bacteria that causes the diphtheria after the animal had recovered. Behring used their antibody-rich blood to successfully immunize humans against the deadly disease. It was a great breakthrough first use of a serum therapy. In 1901, Behring won the first Nobel Prize for such a noble work. Another physician named Francisco Sensi retrieved the blood from a man who had recovered from measles and used to inoculate children, but it did not cure their measles. After the 5 years, during the measles epidemic, Sensi tried injecting severely ill children with convalescent blood again and found that it helped them to recover more quickly. Edwin Kohn, a biochemist who was a game changer, figured out how to split blood, and for the first time, plasma could get separated from blood. Plasma therapy is a medical procedure that uses the blood plasma of a recovered patient to create antibodies in an infected person. Physicians called it as a convalescent plasma therapy. Now, what are the steps involved in plasma donation? First, blood is taken from the previously infected but completely recovered patient. The separated plasma, which contains the antibodies against the particular disease, is then injected into the patient's body that will fight the virus and neutralizes it from spreading. Before giving you plasma, your doctor will examine your overall health. If all fine, will insert the IV tube in a vein on your arm. It takes approximately 2 hours to the complete procedure. Your healthcare professional may monitor your health for a few more visits. Every bright side has an opposite dark side. There are certain risks involved in a plasma therapy. As it involves a blood transfusion, there could be a risk of prevalent viruses from recovered patients. Transfusion of plasma can lead to adverse reactions. These are immune-mediated reactions, allergic, anaphylactic reactions, acute lung injury, and hemolysis, which may be mild to severe. Thus, the doctor must assess the donor's health before donating plasma. Remember, every human's body reacts in a different way to the treatment and medicines. Many of us having this question, can I donate plasma if I have recovered from COVID-19? Yes, surely you can, but you should meet the following criteria. First, if you have been diagnosed with COVID-19 by laboratory and meet its criteria. Second, you must be fully recovered from COVID-19 and its symptoms. Third, if you have no prevailing diseases or chronic diseases like diabetes, asthma, and BP, contact your blood bank or a nearby hospital in order to donate plasma. Plasma therapy has proven to be effective, especially in recent COVID patients with severe infection. However, there is more research that is being done to understand its efficacy on the COVID patients. So guys, you were watching Factomania by Vishu. Please like and subscribe. Thank you.